Welcome to the IRF and LTech Virtual Training Program, Part 1. I'm Lisa Newton, and I'll be presenting Section J, Health Conditions. I'm a registered nurse with experience in direct patient care, clinical education, and executive level administration in the acute care and LTech settings. Currently, I'm a senior staff associate at Econometrica in Bethesda, Maryland. Let's begin with an understanding of the objectives for this session. At the conclusion of this training, you should be able to identify the new and revised assessment items in Section J, and also discuss guidance changes for the Section J standardized data elements. There are several important implications regarding the changes that have been made to Section J. First, the pain data elements are new to both the IRF and LTech settings. These items are J0510, pain effect on sleep, J0520, pain interference with therapy activities, and J0530, pain interference with day-to-day activities. There have also been some minor revisions to the fall items, J1750 through J1900. The fall items are not new to IRF and LTech, so we'll only be focusing on the major changes. There's been a slight revision to the wording of the fall items. The fall definition has been revised, and coding examples have been enhanced for clarity, and gender-neutral language has been added. Now let's review the pain interview, J0510 through J0530. The intent of the pain interview items is to assess the effect of pain on sleep, pain interference with therapy activities, and pain interference with day-to-day activities. In order to have a full understanding of the pain interview, it's also important to comprehend the rationale for collecting these items. The effects of unrelieved pain impact the individual in terms of function, complications of immobility, skin breakdown, and infections. Pain also significantly adversely affects a person's quality of life, and it's tightly linked to depression, diminished self-confidence and self-esteem, as well as an increase in behavior problems, particularly for patients who are cognitively impaired. People may also limit their activities to avoid having pain. Their report of lower pain frequency may reflect their avoidance of activity more than it actually reflects adequate pain management. The assessment of pain is not associated with any particular approach to pain management. As we know, the use of opioids is associated with serious complications. So alternatively, there are a wide variety of successful non-pharmacologic and non-opioid approaches to pain management that may be considered. This slide provides a list of other pain management strategies that can be utilized. And this is just, some of the examples, but not an all-inclusive list. You can see from the modalities identified that a wide variety of approaches to pain management are available. Having a sound understanding of the definition of pain is important when coding these items. As defined in the guidance, pain is any type of physical pain or discomfort in any part of the body. It may be localized to one area or may be more generalized. It may be acute or chronic, continuous or intermittent, or occur at rest or with movement. Pain is very subjective, and this is an important aspect of the definition of pain because pain is whatever the experiencing person says it is and exists wherever they say it does. The pain interview steps for assessment are as follows. First, directly ask the patient each item in the pain interview, J0510 through J0530, in the order provided. If the patient seems unsure or hesitant, you can use other terms for pain or follow-up discussion. Some patients avoid using the term pain, but may report that they hurt, for example, or patients may also use other terms such as aching or burning to describe pain. And two, if a patient chooses not to answer a particular item, accept their refusal, code 8, unable to answer, and move on to the next item. And number 3, if the patient is unsure about whether the pain effect or interference occurred in the 5-day time interval, prompt the patient to think about the most recent episode of pain and then try to determine whether it occurred within the look-back period. Here are two important coding tips that apply to the pain interview. First, these items should be coded based on the patient's interpretation of the provided response options for frequency. And if the patient is unable to decide between two options, then the assessor should code for the option with a higher frequency. Now let's look at each item in the pain interview, beginning with J0510, pain effect on sleep. Here is a screenshot of J0510, and for this item, it's important to note that IRF and LTEC have different skip patterns. The J0510 steps for assessment include the following: read the question and response choices as written. No predetermined definitions are offered to the patient. This is very important. The response should be based on the patient's interpretation of the frequency response options. If the patient's response does not lead to a clear answer, repeat the patient's response and then try to narrow the focus of the response with additional follow-up questions. To make this a little clearer, let's look at an example for J0510. So in this example, the assessor begins by asking the patient, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? And then reads the response choices. The patient responds by saying, I always have trouble sleeping. Then the assessor might reply, you always have trouble sleeping. Is it your pain that makes it hard for you to sleep? In this example, the patient's initial response did not lead to a clear answer. The patient, as you recall, responded with a statement, not an answer to the assessor's question. So the assessor repeated the patient's response, which was, you always have trouble sleeping, and then proceeded to narrow down the focus of the response with an additional follow-up question. In terms of coding instructions, for both IRF and LTEC, you should complete the admission assessment as close to the time of admission as possible and complete the discharge assessment as close to the time of discharge as possible. For the LTEC setting, please note that J0510 is only completed if A0250, reason for assessment, is 01 admission or 10 planned discharge. When coding J0510, you ask the patient, over the past 5 days, how much of the time has pain made it hard for you to sleep at night? Response options include code 0, does not apply. If the patient responds, they did not have any pain or hurting in the past 5 days. Code 1, rarely or not at all. If the patient responds that pain has been present and the pain rarely or not at all made it hard to sleep in the past 5 days. And code 2, occasionally, if the patient responds that pain has occasionally made it hard to sleep in the past 5 days. It's important to understand the key difference between code 0, does not apply, and code 1, rarely or not at all. For code 0, the patient reports no pain or hurting in the past 5 days. But for code 1, the patient reports that pain or hurting has been present in the past 5 days, but has rarely or not at all impacted sleep. And this is a very important distinction. If the patient reports they had pain in the past 5 days and the pain does not interfere with patient's sleep, so for example, if the pain is using pain management strategies effectively, then you code 1, rarely or not at all. Additional codes for this item include code 2, frequently, if the patient responds that pain has frequently made it hard to sleep in the past 5 days. Code 4, almost constantly, if the patient responds that pain has almost constantly made it hard to sleep in the past 5 days. And code 8, unable to answer, if the patient is unable to answer the question or does not respond or perhaps gives a nonsensical response. Now let's discuss J0520, pain interference with therapy activities. Here is the item screenshot for J0520. Important for coding this item is an understanding of rehabilitation therapy as defined in the guidance. It is a special healthcare service or programs that help a person regain physical, mental, and or cognitive thinking and learning abilities that have been lost or impaired as a result of disease, injury, or treatment. Examples include physical therapy, occupational therapy, speech therapy, and cardiac and pulmonary therapies. The steps for assessment for J0520 include the following. 1, read the question and response choices as written. And 2, confirm that the patient has been offered rehabilitation therapies during the reference time frame. For this item, please note that rehabilitation therapies may include treatment supervised in person by either a nurse or a therapist or other staff, or it also may include the patient carrying out a prescribed therapy program without staff present. The J0520 coding instructions for the admission and discharge assessments are the same as we discussed previously for J0510, and they're listed on this slide. When coding J0520, you ask the patient, over the past 5 days, how often have you limited your participation in rehabilitation therapy sessions due to pain? Response options include code 0, does not apply. If the patient responds, they did not participate in rehabilitation therapy for reasons unrelated to pain. So for example, therapy wasn't needed, or there might have been some scheduling difficulties. Those would be examples in the past 5 days. Code 1, rarely or not at all. If the patient responds that pain has rarely or not at all limited participation in rehabilitation therapy sessions in the past 5 days. And code 2, occasionally, if the patient responds that pain has occasionally limited participation in rehabilitation therapy sessions in the past 5 days. Additional codes include code 3, frequently, if the patient responds that pain has frequently limited participation, code 04, almost constantly, and code 8, unable to answer, if the patient is unable to answer the question, does not respond, or gives a nonsensical response. The last item in the pain interview is J0530, pain interference with day-to-day activities. Here we see a screenshot of J0530, and for the steps for assessment, you read the question and the response choices as written. Again, the coding instructions for the admission and discharge assessments are the same as for the other 2 pain assessment items, J0510 and J0520, and they're listed on this slide. The coding instructions for J0530 are also noted here. When coding this item, you ask the patient, over the past 5 days, how often have you limited your day-to-day activities? Now, this is excluding rehabilitation therapy sessions because of pain. And the response options are noted here. Code 1, rarely or not at all. Code 2, occasionally. Code 3, frequently. Code 4, almost constantly. And code 8, unable to answer. Now let's move on to discuss the changes to the fall items. There are 3 fall items, J1750, history of falls. This item is only collected in the IRF setting. J1800, any falls since admission, and J1900, number of falls since admission. These items are not new to IRF and LTEC, so we'll only be focusing on a discussion of the major changes. There have been some general revisions to the guidance for these items. The intent of the fall items was revised slightly to clarify the specific data elements collected. So item numbers were added to the intent statement in the guidance. And the fall definition has been clarified with the addition of a reference to the anticipated loss of balance resulting from a supervised therapeutic intervention. Let's take a closer look at the fall definition. This is the first portion of the fall definition, which should be familiar to you, and it has not changed. However, on this slide, this is the second portion of the fall definition, and the reference in the last bullet has been revised. So let's spend a moment to review this. The language noted in blue was actually previously a coding tip. This language was reworded for clarification and relocated within the fall definition as this last statement. It now states that an anticipated loss of balance resulting from a supervised therapeutic intervention where the patient's balance is being intentionally challenged during balance training is not considered a fall. Let's briefly review the updates to each of the fall items. J1750, History of Falls, is an IRF item only, and there were minor updates made to this item. In the steps for assessment, the reference to the patient interview was revised slightly to enhance clarity, and it includes a reference to speak with family members or significant others to obtain the patient's fall history as appropriate. Coding examples for this item were also updated with gender-neutral language, and just as a reminder, J1750 is not collected on the LCDS. There were a few updates to J1800, any falls since admission, and this item is collected by both IRF and LTAC. The skip pattern was revised for response option no. This item now skips to K0520, nutritional approaches, instead of M0210, unhealed pressure ulcers and injuries. Coding examples were also revised for clarity and updated with gender-neutral language. For J1900, number of falls since admission, again collected by both IRF and LTAC, the coding examples were also revised for clarity and updated with gender-neutral language. Looking more specifically at the updates for J1900 that apply to the IRF setting, an item rationale was added, noting falls as a leading cause of morbidity and mortality, and recognizing the impact that a fear of falling has on quality of life. A coding tip was revised to clarify how to code falls during a program interruption. For J1900, you include all falls that occurred since the time of admission, and this would include any falls that occurred during a program interruption. For J1900, the specific updates for the LTAC setting include that coding instructions were enhanced to include a reminder to complete J1900 at the time of discharge, and a new coding tip was added regarding how to code falls during a program interruption. Similar to IRF, for J1900, you include all falls that occurred since the time of admission, and this would include any falls that occurred during a program interruption. So in summary, Section J contains new pain interview items for IRF and LTAC. These are J0510, pain effect on sleep, J0520, pain interference with therapy activities, and J0530, pain interference with day-to-day activities. And general revisions were made to the guidance for Section J regarding the fall items to enhance clarity and include gender-neutral language. We've covered a lot of information in this session, so you may find that you have questions about the content. If you would like to submit a question regarding this presentation, please send it to pactraining@econometricainc.com by June 3rd, 2022. As a reminder, a practice coding workshop will be held in June, and we encourage you to attend. Select questions will be answered in a Q&A session during the June 2022 virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.